Thank you, sir. Thank you. Deepu, all yours.
Yes. Good afternoon, all. Once again, we are in this Forefront of Future Frontiers webinar on this Friday afternoon. Nice to see you all online again. And myself, Dr. S. Deepa, President Scientific, will be hosting the session today. Triple F webinar, popular across the nation by its name as Triple F webinar. It is a theme-based medical webinar series, and we have completed successfully 100 episodes. Last month in the July, we had the Centurion webinar. Now, with a great start, we are at the 101 episode, 101, with the theme of trends in medical education. And we have a renowned resource person from KLE Academy of Higher Education and Research, Dr. Jyoti M. Nagamoti. She is a controller of examination and professor of microbiology, JN Medical College, with the topic on building the quality into assessments, goals, rules, and tools. As we know, the world stopped looking into the quantity. Stopped means it's not stopped, it has reduced looking into quantity. We are now looking into the quality. Quality is what matters now. Either it is a surgery you are doing, you are organizing a program or whatever may be. And all the accreditation processes are also into the quality. And we have NAC, NABH, HOPE looking into the quality, and qualitative matrices are given more of value. And we have Madam here, Dr. Jyoti, to address these issues with respect to medical education. With this, I'll like to invite our beloved Dean, Professor P.F. Kotu, sir, to give the introduction and also opening remarks, and also to introduce the speaker of the day. Over to you, sir, please.
Thank you, Dr. Deepa. I just got disconnected for a short while, just now, about 2 minutes back. Now I have my screen is visible.
Yes, sir.
No issues,
Yes, sir.
sir.
Your screen is
Am I audible?
Audible.
Yes, sir.
Yeah. So I have every reason to be ecstatic today, because first and foremost thing is, Dr. Jyoti will also be happy to know we hit a century. And after that century, century is the most crucial thing. Everybody gets knocked out at 99, 98, like that. We crossed 100 and we are now started a fresh batting after 101th episode. That is by Dr. Jyoti Nagamoti. That's one. And second thing is, my own student is delivering today's 101st episode of this Triple F webinar. I'm very, very happy because of that reason. And third thing is, the reason is it is something related to medical education, for which I also got certain degree of inclination. So because of all these three reasons, I'm very, very, that's why I said ecstatic on this moment for this Triple F webinar, which is conducted on every Friday. And now, let me, on behalf of our management, on behalf of our university at large, Honorable Chancellor, take this opportunity of welcoming all the participants and today's esteemed resource person, my own student, Dr. Jyoti. And this, just for the information of Dr. Jyoti, she already knows about it. This platform has been shared by quite eminent personalities in various educationist scholars, then the researchers of national and international repute have shared this. Wonderful. And now, after this hitting a century, we have our leadership team has decided to do it once in a month. And how much. I don't use the word taxing, how much of efforts it required to get it uninterruptedly displayed or conducting for 100 episodes. I'm a special thanks to the grit of Professor Mahalakshmi, our Dean of Health Profession Education, but for whom now we may not reach this target. That's a wonderful thing. And of course, it helped us to get ourselves mapped in the international map, internal academic map, and where the AVMC has made a certain brand. That's what about the Triple F. It will continue. It has become an inherent character, an attribute of AVMC, and it shall continue hereafter every month. And now, before I introduce Dr. Jyoti, I just like to share a couple of thoughts appropriate for this topic which Dr. Jyoti has chosen. We are amidst of medical education reform or reformation, both. We are halfway through that at various levels, UG level, PG levels. And we all know that is competency-based curriculum is rolled out for UG as well as the PG curriculum by our regulating council. And we're halfway through it, I said. And now you also know that no curriculum will be complete without assessment. Assessment is an integral part of the curriculum. When you say a competency-based curriculum, we all know that assessment of competency is not as easy as one thinks. Assessment of competency is a quite complex, of course, which requires much of thinking, much of tools, much of innovations. These things are required for that. And we call it as an outcome-based education. Outcome of any educational paradigm or exercise will not be possible without properly assessing the outcome. So the tool has to have that qualities, has to have the qualities of assessment. What we call it as the internal attributes or characteristics, or what you call them in the technical psychometric qualities of validity, reliability, appropriateness. Those are all the things when we talk of suitability or the quality of psychometric qualities of a tool. And so much work has been done and is being done across the globe on such a wonderful, interesting topic for all the educationists. And Professor Jyoti also will be happy to know that we have our medical education here in AVMC quite strong, one of the strongest things. In fact, your Vice Chancellor had come as a leader of our peer team of the NAC to assess us, and we earned NAC A grade. That's one thing I proudly share at this point of time. And after having some thoughts on this, we are quite justified in having Dr. Jyoti, who is presently the controller of examinations of a prestigious KLE University of Higher Education and Research, KAHER. She is a controller of examination, and I see Dr. Jyoti growing in front of me only, and as an undergraduate, as a postgraduate, as an assistant professor, as a professor. Then she was the founder, director of the newly constituted University Department of Education for Health Professionals way back in 2006. That was a wonderful thing, and the institution is doing quite. And in fact, our venture to introduce MHPE for the first time in India, for some reasons or the other, for which the institution was not responsible. That was that. And of course, we had a 10 years long grand support of University of Illinois Department of Medical Education. The team used to come. This is how we had built. Jyoti is a product of that, And I remember you both had enrolled for PGD. This one. I remember those days. And she is a former Dean of Faculty of Interdisciplinary Research basically she's a microbiologist, reached the national platform as regards the Association of Microbiologists is concerned, as regards the journal is concerned. And even her husband is also microbiologist, Mahantesh. He is also our student. We are proud students of us, and they have managed that Journal of the Microbiology as well. And slide is not moving. And she is a member of the NAMS, National Academy of Medical Sciences. Of course, she did the fellowship in the UIC. We are all deputed one by one to Chicago. They were all nice days. And she is a FAMER fellow, and he is a FAMER faculty. She has traveled across the country to have these FAMER courses. And she is a national faculty for microbiology and normal lecture series. That is captured over here in the very city of Chennai. She used to travel to Chennai for this recording of this lecture series. And She has established a unique CBME micro skill laboratory. That's what we were talking just now before the start of the session. Government funded. That is, in fact, when I saw it some 1 or 2 years back, I was also, what skill lab this microbiology will have. Only I go through that, I realize my ignorance about that. And of course, Mahalakshmi has declared that she wants to see it. Certainly, we'll see it. And of course, she is a national faculty for basic and advanced course in medical education and the CBME UG curriculum committee of the prestigious state university, Rajiv Gandhi University of Health Sciences, Bangalore. She has contributed books, and she has got about nearly 50 publications. Then she herself has published microbiology practical book, and she is a recipient of the Best Teacher Award of the KLE University. KLE University is having a 250, now it must be 300 institutions, I think. It is a prestigious award to be recognized as a Best Teacher Award given by not KLE University, the KLE Society. That's a wonderful thing, I can really proudly say. And she, apart from that, she has got a Kelkar Memorial Gold Medal for Best Paper. So these are some credentials which Dr. Jyoti has earned in her career, in her journey, and now she is holding the prestigious controller of examination position of our KLE University at Belgavi. And I think I just try to introduce her in a very brief way. Now I won't be taking much of the time. Now I think it's up to Dr. Jyoti to share her thoughts, share her screen, share her all whatever innovations, whatever things that she has. Thank you very much, Dr. Jyoti. Thank you, Deepa.
Thank you, sir, for a nice introduction. Of course, it is a proud moment for you as a teacher to have your student with us in this grand virtual platform on our 101st episode. Before I give the screen to Dr. Jyoti, I have few announcements. The session is being recorded for academic purpose and it is available at our YouTube channel, AVMC Puducherry. And kindly mute yourself and please post the queries in the chat box for the speaker. It will be taken up for discussion at the end of the session. Over to you, ma'am. The screen is yours, Dr. Jyoti.
Thank you, ma'am, and thank you, sir, for your kind words. I'll share my screen. Sorry.
1 minute. Let me just.
Ma'am, are the slides visible?
No, not yet.
Not yet?
Not yet. Not yet.
Okay. Should I say share first?
You have to start sharing, madam.
Okay. Yeah, I'll do that. Is it visible now?
No, madam.
No.
Yeah, ma'am. You are started to share the content.
Okay, ma'am. Yeah.
All the slides are visible. The particular. Yeah, ma'am. It is in full screen.
Okay.
Please.
So is it good to begin now?
Full screen, Jyoti. Is
full
it a
screen?
screen?
Slides are not visible?
Yes,
No, slides are
yes,
visible.
ma'am. It is visible. Sir, it is in full screen only, sir.
It's visible, sir. It's in full screen.
It's visible in full screen only.
Okay.
Great to go, ma'am. Thank you.
Okay. Yeah. Thank you. Very good afternoon, everyone, all the participants. At the outset, I thank the organizers, especially Dr. Kotur sir, ma'am, and their whole team for giving me the opportunity to talk on a little bit of my experiences in how do we build quality into the present assessments, because the scenario has quite changed. We are into competency or outcome-based assessments, which needs to be quite robust, and we need to integrate quality into it. So in this regard, I have selected the topic of building quality into assessments. In today's session, we are going to learn some goals, some rules, and the tools we are going to use. As we are aware that in the educational spiral, assessment is an important component and it forms an integral part of the educational wheel or the spiral. It is also said that assessment is like an engine that drives learning. I firmly believe in this. I had the opportunity to get trained in UIC because this term was coined from one of the faculty members from the UIC. It is also very well said that grab your students by your tests. Their hearts and minds will follow. Again, this is a very important statement. Our students will learn the way we assess them. Coming to the present context, other assessments are mostly or probably not done to the extent they have to be made utilized for the learning purpose. The skills are probably assessed in silos. There may be lack of validation or quality component thought into or put into the process of assessment. And as a result, the outcome attainment is obviously questionable, or there may be variable attainment of outcomes or the competencies. In this kind of situation, probably we may be teaching our students to the test, and the students are quite smart enough to learn the skills for the test purpose. They may learn it, they may forget it. So this is related to assessment of learning. But now we are in the paradigm of shift of moving from assessment of learning to assessment for learning. Though there is just a single word which is changed, but the whole scenario of assessment changes when we shift from this gear to this. So we are in the era of assessment for learning. That is why learning, how do we make our students to learn from our assessment is the crux of today's assessment. The purpose of our assessments in present scenario also should be our assessment should act as both diagnostic and therapeutic tools for both teachers and students. They will act as a diagnostic tool because they will make the teachers and students realize where we are and where we need to go. Is there any modification or changes that are required from both our sides to improve learning from assessments? And also they act as therapeutic tool because the results are the evidence of how well our students have imbibed the competencies or the skills from our learning. The purpose of assessment is also to provide timely, specific, constructive and corrective feedback. Feedback is an integral component of assessment. They will make the student to climb up in the ladder of learning, and they also come to know that where they still need to go and reach with the constructive feedback. The purpose is ultimately to make our students become lifelong learners. So this brings me to the objectives of today's session. I'm sure at the end of today's program, we all will definitely start thinking about quality into assessments. Unless there is quality, there cannot be good assessment. So I'm sure at the end of this program, all the participants shall understand the context of present assessments and also the importance of incorporating quality or validity into our assessments. So quality equals to validity. In the same manner, in today's session, we are also going to look into some of the threats to validity or the dangers to validity or the factors that determine or affect validity, which if we are aware of those, we can definitely take corrective measures to incorporate quality into assessments. Also, I can ensure you that with the little small steps, we are able to learn and practice quality assessments. So how are we going to meet the objectives of today's session of learning and practicing quality assessments? We are going to address this session in three components. What are quality assessments? Why it is so important to go for quality assessments, and how do we do that? The moment we talk about quality, we feel quality is invisible and it is quite difficult to incorporate it into our practices. But I'm very sure that it is into our own tools and the rules what we put for ourselves in the assessments, they can make a change, and they will definitely affect the quality assessments, and that is how we are going to incorporate and learn in today's session. So what is quality? Quality is all about validity, reliability in assessments. Of course, as said by Van der Vleuten, that quality, along with these parameters, as I said, quality is validity, reliability. It is also related to acceptability of the tool or the assessment system in our educational practice and educational impact our scores are going to make on the students or on the community, and also how feasible are our assessment systems. So these all determine the quality, but basically quality is all about validity and reliability, and objectivity is the component of reliability. So what is validity? You can start answering in the chat box. Okay, meanwhile, you keep answering in the chat box. I will go ahead. In simple terms, validity is nothing but measuring what we intend to measure. That is very right, but it is not as simple as it is defined here. It has got much more into it. It is nothing but, and also it is not the score or the tool that determines the validity of the assessments, but it is the meaning that we infer from our scores determines the validity. And also it is the empirical evidence which is needed to support or refute the meaning assigned to our scores. That is nothing but validity. I'm sure the first sentence we all understood very well, but don't worry about the other two, which I'm sure I'm going to make it very clear that what is the meaning of these two other sentences, and that is very important to learn the validity issues about in this session. Validity is affected by whatever we do in our assessments. I can say whatever we do in assessments definitely has a component to contribute for the validity. As I said that what we do, what we assess, what is the objective or the construct of the assessment? Is it clinical reasoning? Is it professionalism? Or it also, what is the content that we are assessing? Is it the knowledge component, skill, or the attitude component? Why we assess, that also determines the validity. Is it the standard setting? Is it going to tell a student as pass or fail, or is it going to qualify a student for entrance into a university or something? It also is determined by how we conduct our assessments, what tools we use. Is it the written tool, written exams or oral exams, practicals, etc. It has also got to do with who will assess. Is it the trained teachers, or is it the self-assessment, peer assessment, or multi-source or 360 degrees assessment? When are we going to assess our students during their training? Is it day-to-day assessment or the formative assessment, or is it a summative or high-stakes assessment? At what point of training? Is it a pre-test, or is it a post-test, or is it day-to-day assessment? When are we assessing also matters. Under what settings or situations are we assessing our students? Is it a simulated setting or a real life setting? Is it in a adverse condition or not? Is it in a favorable environment? All these factors, though appear very small, are going to affect for validity. Validity in scientific terms depends upon the construct or the test objective. Again, the word construct is a encompass. It encompasses lot of attributes into it. It is not as simple as said as the test objective. For example, if we are assessing leadership quality, it includes the leadership assessment includes lot of other attributes. So the construct is leadership assessment or a clinical reasoning skill, but it encompasses so many other components into it. But in general, we can take it as the theme or the essence of assessment. That is a very, very, very important component which determines the validity. It is as simple as if we are assessing a person for one construct and we cannot generalize those scores for something else. The second thing is the content that we are going to assess, the tool that we are going to use. It again, not only the tool comes under the content, it is the whole bunch of competencies or the skills that encompasses in a curriculum or a syllabus. Other than that, validity also depends upon the criteria or the conditions. It also depends upon the educational impact that is made on the student or the community or the employers. Is it a high stakes exam or a assessment for learning or the formative assessment? Is it going to classify a student as pass or fail, or is it just going to end into giving some constructive feedback and push the candidate to the next step? It also is determined by the reliability and objectivity. We are going to elaborate on these terminologies: validity, reliability, objectivity, with a lot of examples. So after that, we will be very clear with what is the meaning of these very important terminologies. So that was about the reliability. That was about the validity. Coming to the reliability. Hope everyone is with me. Everything going on well? Am I heard? My slides are visible?
Yes.
Okay.
Yes.
Thank you.
Thank you, madam.
Thank you. Thank you. So what is reliability? Again, you can start answering in the chat box. I'm sure somebody must have written this answer, that it is nothing but measure of repeatability. It is the measure of repeatability. Let us understand it in simple terms. For example, an examiner assess one student in different settings. He should be able to get the similar score. That is, one should get the similar scores if tested again by the same examiner, but in different conditions. That is the measure of repeatability. We should be able to get similar scores. It may vary in decimals, but it should be a similar score. That means the test has got good reliability. Reliability is measured in terms of coefficient and standard error of measurement. Again, reliability is also when different examiners are going to assess the students under different conditions. Both should get similar results. As I said, similar, there can be little variation. This is called as inter-rater variability, which is acceptable to certain extent. If it is the difference is huge, it is going to matter, or it can introduce bias component into the assessments. So reliability is a very important component of validity, and the reliability is also affected by so many factors, as we discussed with the validity. Reliability is controlled by number of factors related to students, examiners, and also the setting. As I said, if there are adverse setting, or if the students are not familiar or trained in certain environments, they may produce variable scores of the results. The factors that control reliability are inappropriate length of tests. For example, some students got an easy test and some of them got only 20 questions, others got 100 questions, quite difficult. So all those things are going to matter for the validity in turn. Of course, for reliability, because reliability is a component of validity, validity is definitely going to be affected. Inappropriate timing, if the students are not trained or not oriented or not familiar with the tools we are using or related to the content learning as well, the timing really matters. Inter-rater variability, as I said, the difference in the scores between two raters, it is going to matter for reliability. Non-homogeneous tasks given to the students. For example, when I was an undergraduate student, I got a CNS case and my friend got a very easy abdominal case, and there were definitely, we were marked differently, right? So that is what it is. Non-conducive environment, as I said, the student should be made comfortable, familiar with the environment also. All these factors are going to matter to the reliability, hence affect the validity of the assessments. So now what is objectivity? It's a small component, but it is important. What is it? Objectivity is the accuracy of measurement. For example, our objective questions compared to the long questions, the objectivity is very good. It is either 0 or 1. But whereas if there is a question of 10 marker long question, there can be lot of variation in scoring the same answer by different raters or same rater if under different conditions. So objectivity is the accuracy of measurement. To understand these terminologies in a better way, in a very simplistic manner, I always give this example what I give is popularly learned from Dr. D.K. Srinivas. For example, let's understand these concepts of validity, reliability, and objectivity. From this example, as I said, the test objective here is that I want to measure a student's ability to measure the length of this table. So there are many tools available, including the visual tool, isn't it? Visually, I can say the length may be 5.5 feet. I can also use a better tool. I can use a rubber band and say that 5 times or 6 times this big rubber band, it counts. It is definitely better than the visual tool, but again, that is not the best measuring tool, because we have another good one, that is this tape. This is the Taylor's tape. Is it better than this? And definitely better than this visual, because somebody else may say that it is 3.5 or 4 or something, 4 feet, but one tool is definitely better than other. But having said that this is the better tool, is it the best tool to measure? Is there something else available? You can put your answers in the chat box again. Because this is a wooden table, I think the carpenter's tape is the best tool to measure. Right? I think we're all understanding this example related to the validity, in the sense, are we measuring what we are supposed to measure, isn't it? That is validity. We can measure using our visual tool, visual gauge, or some other better tools. But one is better than other. So we can say that by using the carpenter tapes, the scores what we derive are mostly more valid compared to, or the meaning what we assign to this is that the student is able to use a best tool to measure, and he is able to give us the accurate readings. Now let us discuss this with the example of, related to the reliability. Which tool amongst these 4 is more reliable? I'm sure you all must have said that this is the most reliable tool. The word reliable, we can definitely many times in common dialogues, we say that I go to this particular tailor because I find him very reliable, isn't it? So this tool also is more reliable compared to this, because just now I said 5.5, after 1 hour I may say it must be just 4 feet, right? So this is the best one. Anybody measures this table using this tool is going to get the same readings again and again. Having said that, I hope these things are very simple and clear to you now. What is validity? Are we measuring the length? Yes. But using the better tool? Yes. Reliability, the carpenter's tape is most reliable. Having assigned this tool as the best tool to measure the length of the table, when it comes to measuring pressure in this balloon, can it measure pressure in this balloon? Because we have said that it is the best tool to measure something. That doesn't mean that a valid or a reliable instrument cannot be considered as the same when we have different objectives or the constructs. Here the construct has changed. It is not the same as measuring the length, but we are trying to measure the pressure in the balloon. Definitely, this is not the tool. We can say it is very, very low on validity because we are not measuring what we intend to measure here. Very, very low on validity. Absolutely, it measures something. It may measure the length or breadth of the balloon, but it cannot measure the pressure. So validity is not an absolute term. It is always varies. I mean, in the sense it is in decimals. It is not an absolute term. Completely, there is no instrument which can be valid or invalid. But here in this example, we have discussed validity, reliability, and objectivity. This tool is highly objective because it gives even the millimeters difference in the length. Okay. I hope we are all clear on that. Can I go ahead?
Yes, madam. Yes, madam. Please.
Yes. Now let's take another very interesting example to understand these terminologies in a better way, because I believe once we understand these terminologies, it just comes, the validity just becomes our habit. So I have made an attempt to explain these terminologies again by this example. So what I do is I'll play a video. The objective of this test, I'll show you a video wherein a man is running. You need to score him on the scale 1 to 10. Okay, here it goes. The objective of my test, or the objective or the purpose of conducting this test is to assess his ability to run for 100-meter Olympics.
You need to click that one, the arrow, right arrow.
Sorry, ma'am.
The play button you have to hit.
Yeah. I can't find that.
Yeah, that first button, madam.
Yes, yes. Yeah. Please watch and grade. Well, that's it. Score this run on a scale from 0 to 10.
Ma'am, we are seeing screen in screen.
Is it?
You'll have to stop sharing
Okay.
and then again go share.
Yes, ma'am. Yeah.
But then we'll see if any messages come in the chat box.
Yes, ma'am, please.
Yeah, full screen, that's all. You got the slides? Yeah,
Yeah.
we got it.
Okay. Yeah. Are
Deepa,
there...
you can read out, Deepa, the screen.
We got one reply as 10, one as 8, and we have one more reply like we need to define the score.
Okay. Yeah, but we will do all that, but ask them to just score. Participants kindly score. It can be 0. I don't know whether it can be 0 because the construct or the objective is I'm going to select this person or not select him for 100-meter Olympics based on this test conducted by me. It can be 5, 6, anything. So I heard it was
One
8.
more 10 answer has come, ma'am.
Okay, so full score. Very
For
lenient
100 meter, they
examiner.
have given 1 score, ma'am.
Okay. Very tough examiner.
6, ma'am.
6. Neutral examiner. Okay. It may vary, isn't it? What we learn from this is that it is going to vary. Because what was the tool we used here?
Tool is running.
Visual, observation. Observation was the tool we used, and we assessed this person's run. Do you think these scores are valid?
No, ma'am.
No, ma'am. Even when we give, I don't know, I don't think exactly everyone would have put based upon what they really observed.
Okay. Yes, everyone is right, or everyone is trying to interpret validity in their own words, and it is correct. Again, let us, are the scores reliable? See, we got a range from 1 to 10 now. We got the scores ranging from 1 to 10. So there is a high inter-rater variability. This similar thing will happen when we are assessing the long question answers to the long questions, isn't it? Essay questions. Similar thing can happen, or there is more of a central tendency. We want to be not too strict or too lenient, and we want to usually be on the average scores. So all that can happen. Do you think these scores are completely invalid? The person who has scored 1 and 10, are they completely invalid? They cannot be. And also we will discuss why this inter-rater variability is more in this particular example. Now, can you also think, are they reliable scores? That means if I play that video again, same observers or the rater, are they going to score the same, do you think? I don't think. They are definitely going to change. That means the scores are less reliable. Are the scores objective? Definitely
No,
no,
madam.
because
Each of us used our own
yes, exactly.
criteria.
I didn't put any conditions or criteria. Neither I told that what was the setting I have given, because it is to select this person for Olympics. Is it a right kind of a setting? Nothing was told to the raters. Raters were not trained. It just came as a surprise test, isn't it? So all these things are going to matter. Now we'll go a step ahead and learn validity in terms of construct, content, criteria, educational impact it is going to make, and the reliability and objectivity of the same test. Okay, take a minute time and just think of the score that you have assigned to this particular test, and do you think if the construct or the test objective was already known to you, but is it going to make difference? how valid are these scores in terms of these particular components.
You want us to type, madam?
No, that's fine. It will take some time. Otherwise, just after about half a minute, I'll start discussing to save on time. Well, we'll start discussing about the test objective. Think that I had not told you the purpose of carrying out this test. Also think that in my mind, the purpose was to select this person for a breakdance competition. Think of validity of your score. What meaning have you assigned to this score? For example, somebody has given in 8. That means, can he be selected for the Olympics, or he can be also selected for the dance competition? The person is correct. Also, there is no absolute yes or no answers, as I said, because the running ability here is also meaning that he is able to move his limbs. That is the reason that somebody can claim that he can be a good dancer as well. So, as I said, validity is a relative terminology. There is no absolute yes or no there. In any case, the rater is correct, because the rater is not given a lot of information, no standardized settings. So, similar things I'm going to translate to our working environment and the settings wherein the assessment takes place sometimes in such closed walls and not having proper directives or not defined all the particular quality measures. Okay, without going much into the other things, I hope we all have started thinking about what we do, how we do, and what settings here, and what visual tools. Also think that if there were some other information given to you or the training given to you, you would have been, or a checklist given to you, you would have been better raters. Okay, now after having understood the component, what is validity, reliability, objectivity, we are going to now talk about why building quality into assessments is important. According to me, one and the only one answer to this is our assessments are just meaningless without incorporating validity into it. Do we all agree with this? Because the score we assign will not give us any meaning, and that is how our assessments become meaningless. So that was the answer why quality is important in assessments. Now coming to a very important component of today's session is how do we build quality? As I said, quality is an invisible measure, but there are some rules that we can follow, and we can also, we have some good literature on which if we fall back, we can learn so many things about in day-to-day practice. If we adopt certain simple rules, how we can make our assessment strong and more valid. So going into this component, we are going to learn about how do we inbuild quality into our assessment. So quality is nothing but validity. We are going to talk about more about validity issues. So there are certain basic steps. So let's take in today's competency-based education. We are going to consider as defined by NMC or any national agencies for different courses, their competencies. We need to make a list of them. These are the basic steps before we start going into any assessments, either formative or summative. After we list the competencies, consider only relevant facets of competencies that need to be assessed, because assessing each one of them may not be possible, or they would be classified into those which are assessed in the formative assessments and some in the summative assessment, but determine only relevant facets that we need to assess. For example, clinical reasoning skills or communication skills. We need not assess communication skills on every component, but overall the construct needs to be taken care. Then we need to categorize the competencies into cognitive, those belonging to cognitive, psychomotor, and affective domains. Then we need to define the level of performance. This is called as the standard setting. Which performer or a student you call as a superior or adequate or unacceptable performance. Set the conditions and the criteria. That is very important. In the previous example of run, I did not set any conditions or criteria, and that was a very, very vague assessment. Then we need to choose appropriate tools. As we know, with the help of Bloom's taxonomy, we choose the action verbs. Here is an example of, again, the Miller pyramid of learning and assessment, wherein we have certain tools which are to be used for assessing the knowledge component, that is knows and knows how, and certain other tools which are best to assess the practical skills or the performance skills in all these domains: knowledge, skills, and attitudes. So these are some of the ones which we commonly day in and out we use these tools, and we will talk about how do we build validity and quality into our written tests, our oral exams, and practical tests. So here is some of the tools and rules we are going to learn in the next few slides. Before we learn to imbibe quality into our assessments, it is very important to know what are the threats. Some 10 basic threats to validity I have listed here, which are definitely going to affect our assessments in terms of validity, reliability, and objectivity. Hence, we need to learn these important threats so that building quality is nothing but balancing these threats. If not completely, they are unavoidable. Number one is the threat comes when we do not align the course outcomes with our assessments. Course outcome is something, and we are not using the proper assessment protocol for assessing those outcomes. For example, our product, our physician of coming out of competency-based education should be a clinician, he should be a leader, he should be a good communicator, etc. These are all the construct. But what assessment scheme or the protocol or the format we are using in terms of assessing is knowledge, skills, and attitude in a particular competency. Competency is nothing but a mix of different kinds of skills in different domains. Are we aligning the outcomes with our assessment is very important. That is what is the first point. If we do not align our course contents, content is the key word here, course contents, and also our instructional format, the way we teach and learn, if we do not align our assessments with contents and the instructional format, there is a problem. The third is we are not going, if we do not use or adopt the blueprints. Blueprints are the best grids which tells us that how much to choose from which content, which domain, or which part of the competency. So that is like a good grid or a format which will avoid content undersampling or construct undersampling, and it will also not allow us to overlap the overlap to take place between same domains. Next is not setting any standards for pass or fail, or a superior performer or a mediocre or a low performer. If we do not set the standards and we just do the assessments, there is a problem which all these points are going to matter for validity. Next is having very few tests or a single test, and you are going to call him either qualify internals or do not qualify. Or if if you just call him pass fail in a particular test by using only few items or one or few tests and just grade him on that. Or sometimes we use only few tools. For example, according to the KAHER model, which has been given by Dr. Tejinder Singh et al., it says that we have to minimum use 4 tools. Any tool cannot represent more than 25% in a test format. Have minimum 4 tests, have minimum 4 examiners. So that is the theme of KAHER model, which is very commonly, it can be adopted in our day-to-day assessments. So please do not use a single or very few tools to assign any grade or any pass-fail decision on the students. Not involving multiple examiners. Not only examiners, they should be very familiar with the assessment system, they should be trained, and they should be quite involved in the assessment protocols. If we do not utilize item analysis and build a robust bank based on the pre-validated and post-validated questions in the question banks, there is definitely going to be problem, because there can be too easy questions, there can be highly difficult questions, or some questions are non-functioning or obsolete. All those things are can be determined by using this science of item analysis. And coming to overall, there are certain factors other than our test objective or the construct and the content. Poor test administration in terms of not maintaining the confidentiality, or there is a paper leakage. It can affect few test takers. The results will affect few test takers because the poor students may do very well, or the adverse can happen in such situations. If the tests are not conducted in a proper quality settings, or overall quality of administration of the test is poor, teachers training, etc., all those are also going to matter. So these are some basic threats to validity. Once we know where is a problem, we can definitely address in a better manner. I was just talking about this very important publication, which is called as the KAHER model. I have read it several times to have come to the theme of understanding it in a very simple way. Think each quarter in a circle is going to contribute to 4, number 4. 1 quarter is 4. So have minimum 4 exams for any course that we call as the internal assessments. In 4 multiple settings we can conduct it, or it need not be 4 here, but multiple setting is better. It can be even more than 4. Involve multiple examiners, have minimum 4 examiners, more is better. In the form of OSCE, multiple content OSCE or OSPEs, we have all the scope to practice all the principles told in this publication. Use multiple tools, give multiple assignments to students. This is all going to build quality into our assessments. Only few or single is going to bring the validity to a very low extent. On multiple content areas, do not test. For example, in a medicine exam, there are different systems. We cannot have questions only purely focused on central nervous system or on cardiovascular system and compromising on the others, or there can be even sometimes overlap between the same systems. Okay, now as I told that there are different tools. In the previous slide I had mentioned that these are different tools that we are commonly day-to-day we are using. Let us consider the written tools that we are using, and first of all, let us understand why that test is meant for. What is the goal of using the long essay questions? Long essay questions have the beauty to enable us to test the higher order thinking skills, the descriptive skills, in-depth knowledge, ability of the student to compose and succinctly and coherently compose the answers, or his ability to argue the complex and debatable issues. So these are some of the beauties, but there are some threats. The long questions suffer from poor reliability because, as I said, different raters marking from 0 to 1, 0 to 10, all that variation is very much acceptable, very much is evident in these kinds of tests also, as it happened in the previous example I gave you, because it is very subjective. There is no checklist. There is no, sometimes may not be key answers given, or the examiners may not refer to the key answers. It is these long question also suffer from poor content validity.
Yeah, by bringing to your
Wrong is the question.
Anything?
Madam, there is some background disturbance. Please go ahead. I request all the participants to mute themselves.
Okay, poor content validity, because they suffer from poor content validity in the sense, if we have only 4 long questions in a 100 marks test, there is a severe problem with proper content sampling. Some of the components may be just left alone without assessment. That is why they have the poor content validity. Their inconsistency or inter-rater variability is very much well known in long questions. They are laborious to score. The rater has to read in depth and then mark. Global scoring is sometimes, global scoring is also very evident here, and that may be good, or sometimes it is not very acceptable. Not, it is some questions which are asked in the long question can be very trivial, and we may not be able to assess actually what is the scope given to these questions, may not be able to be assessed. The meaning here is that we need to construct them also very well. Risk of over structuring the questions. For example, 10 marker, I have seen many a times it is split into 2 plus into 5 times. So what is the fun in giving? Using a long question, might as well given 5 short answer questions, isn't it? So it is, sometimes this happens, over structuring is a problem. So these are all the threats. So once we know there are threats, there are some rules that we can apply on putting quality into these long questions. How can we do that? Use the blueprint. This ensures uniform content sampling. Have 10 marker questions in a 100 test. Of course, that is all present in our university examination patterns, but long questions are important because they have certain beauties or advantages. We need to make use of them. Also, other questions will help us to uniformly sample the contents of the whole syllabus. Structure the questions carefully. Minimum have a 5 marker component in a long question, because the beauty of long question is to assess the in-depth argument skills or composition skills, description skills of the student. But rest of it can be asking definitions and etiopathogenesis, important concepts and correlations, analysis can be the part of that question. Use predetermined analytical marking schemes. Again, there are scientific evidences that if you again use too much of analytical marking scheme, you need to use more number of questions to come to general acceptability or generalizability values. Utilize clinical case scenario based questions. Use specific action verbs. See, again, as I said, different levels of learning have got a different list of verbs to be used. So action verbs direct the students very well. Again, if we do not use proper action verbs, we will not be able to classify the questions into different difficulty levels. That is one thing. Other thing is the students will not be specifically directed what to do with that particular topic. For example, describe anemia. That is very non-specific and general, right? So there are different action verbs for each component in the Bloom's taxonomy chart. We can use them. Again, they are going to matter. Coming to what we had done in KL University is way back in 2018, we started a writing retreat wherein a huge number of faculty members would sit. They pre-validated the questions within 8 days, around 95,095 questions. They were structured properly. They were reframed. They were categorized into 6 different difficulty levels based on the Bloom's taxonomy. And ultimately, we built a robust question bank, which has been now linked to a software. The software can pick up the questions at different levels according to the blueprint. Again, we did not leave that attempt there. even during the COVID times, we took online training to the faculty in different disciplines, and also now from 95,000, around 1.7 lakh questions, pre-validated questions we have in our bank, and this is one of a small contribution to building quality into the assessments. Definitely, the way we have moved from without having any directives or just single phrase questions or single word questions also were present in the bank, and now they all have been modified and quality is trying to be getting into our system. Now coming to the short essay questions, as I said, the goal of using the short essay questions is they are good on content sampling because that is their beauty. Next is there are some threats because they are fairly good on reliability because there won't be as much variation, inter-rater variation, but they are better. They are also good on content validity. Now, in the literature, it is said that to achieve acceptable generalizability coefficient of 8, 22 long question, I mean, this applies to the long question. If you want to go scientifically, it is said that you need to have in a question, I mean, in a test, 22 long questions for minimum 5.5 hours to reach to the acceptable generalizability coefficient. So these are some alarming statements which we have come across in the scientific literature. We may not be able to reach to that level, but at least we can move from where we are to the next step of betterment. But that is what is the science. So what we can do, how can we build quality into our short essay questions? Don't simply ask trivial questions or some questions based on recall. We have to always ask why. Why using, explain the mechanism of using certain drug in a particular condition, how it works, why that works, why not the other drug works, or how kind of a questions, what rather than what questions, ask why and how questions. Specify expected number of responses. For example, 5 side effects or 4 side effects of certain things. Use integrated questions seeking the basic science concept, linking them with the clinical science. This is how we can build quality. Multiple choice questions. They are good on content sampling measures, and they can test large body of knowledge. That is why they are used in all high stakes entrance examination. Of course, we can go and construct complex kinds of questions assessing the higher order thinking skills also. And they are good on reliability index. Either it can be 0 or 1, but it cannot be anything other than that. Definitely the scores will not range between 0 to 10. So what is said in the literature about MCQs is a 90-item test has a reliability of about 0.88. That is why they are very popular. Only thing is that needs a lot of inputs in the construction wise, because every questions can be item analyzed, and we'll come to know their indices very well, their difficulty index, discrimination index, then point by serial, etc. Now, what are the threats associated with MCQs? They are, if when poorly constructed, they can be very bad. They can affect the validity. Trivial questions, questions with inbuilt cues, questions poor on psychometric values like difficulty index, etc. So these are the threats. So lot of input in framing the questions, but assessment even can be computerized on OMR sheets. So what are the rules which will make them better on quality? Is again use the blueprints, have 10 MCQs from a particular component or 2 from there. We already know where to draw what based on how many long questions we have had from that system. We can have a blueprint that channelizes our assessment. Use standardized item banks. We are into the process of item analysis also. Pre-validation is done and the post-validation is going on. Utilize context-based or clinical scenario-based questions rather than simple recall type of questions. Adopt a robust item bank. That also really puts validity into the assessments. So we have talked about the written test. A few more words about the practical test. How do we build validity into them? The goal of long case, for example, I've taken very commonly what we use in our final exams is the long case, short case, OSCEs, etc. We'll talk in those lines. The goal of using a long case is to explore their learning value in real life settings. Of course, they have certain threats or disadvantages. Another goal is to explore their value in formative assessments, because they are the ones which helps us to meet assessment for learning, because that is the best setting where the students will learn in real life scenarios and settings that a real life experience can be gained. They are not ideal for high stakes exams, as we know, as I told my own example, that the patients may not be very cooperative, or there may be so many things which may go or may not go in favor of students or the examinations. They are poor on content validity because you can just if you have a long case, half of your marks or your share has gone into the assessment, and rest of it content sampling becomes quite difficult. Poor generalizability across the competencies, because if you have assessed a person in say he is good in CNS, we cannot generalize that he is good in other systems as well. There are some threats, like they have very low on reliability, because again there can be some dramatic situations, or there may be favorable or unfavorable situations wherein the scores will vary, hence they will affect the reliability. According to the literature, if you give 2 long cases, the reliability will be 5%, 0.5%, which is not really acceptable. So to get acceptable score of 0.85, we need to have 10 long cases. Again, as I said, these are all alarming, which is practically not possible. That is why the beauty is to explore them in the formative assessments. We cannot go with so many high number of cases in the summative exams. So keep one and build or replace that reliability and validity issues by using other assessment methods like mini CX or day-to-day assessments, etc. To get this number with minimum 200 minutes of testing time. Again, that is all. That looks quite impractical. They are not ideal for high stakes exams, etc. These are some of the threats of long cases. But how do we build? What can be made better here? Standardize the questions, patients, and the examiner. We can use the simulated cases or the standardized settings like in the labs, simulated labs, skill labs. Use multiple cases, multiple examiners in multiple settings. Again, very easily said, but these are all quite not very practical measures. But if you want to achieve more of validity, we have to try for going into greater numbers. Test multiple competencies. Again, generalizability becomes an issue if we test in one component and can try to generalize on others. Coming to OSCE, these are the best opportunities to assess multiple competencies in multiple standardized settings on predetermined tasks using a standardized checklist. See, everything is standardized here. That is why we expect they are good on reliability, and they are good on objectivity also, because we use the checklist here. But there are some threats here as well. Breaking competencies, too much of structuring of competencies into very simple trivial tasks. That is going to matter for validity. Over structuring of long question, as I said, 2 plus 2 plus 5 times. Same things can happen here, because you are trying to assess a competency which is a unitary concept. It cannot be assessing multiple single skills. Non-standardized settings and patients, untrained faculty and staff, labor intensive, their need for training, etc. Again, minimum number required is about acceptable number, 14 to 18 stations, which is quite possible, and we adopt it here for all our internal assessment. And this year we are trying to go adopting them in the summative exams as well. Testing time is also quite feasible, so this seems to be a reachable dream to get a good reliability coefficient. What are the quality rules here? Use blueprints again, have standardized OSCE stations. We use the blueprint for OSCE separately. Focus on important or core skills to be assessed. Do not try to assess everything. Standardized settings, patients and examiners is very, very important to bring in validity. And also students taking them into confidence and training them, orienting them is also very important. Training the faculty also matters. And having a robust OSCE bank is also a very important requirement for conducting them in the high stakes examination. Use multiple stations. Coming to mini CEX and DOPS. The goal of using them, sorry?
Excuse me, ma'am.
Yes.
We are running short of time. I think a couple of slides you have.
Yeah. I'll try and wind up, ma'am.
Okay.
Yes, ma'am. Okay, I think mini CEX and DOPS also, there are some threats regarding this, but how can we build validity into such kind of assessments is have more number of encounters, utilize these kind of settings or the formats for assessing formative, adopt them in the formative assessments. Okay. So till now, what we have done is we had defined certain number of tools to be used for assessing knows how category and shows and does category. After that, I will give you a summary of what are 10 basic rules in a nutshell to build validity into our assessments. First thing is align the assessment with course objectives, learning outcomes, align our assessments with course contents also and the teaching learning methodology, use blueprints, use standard setting, define the criteria for pass, fail or selection, increase the frequency of testing, increase the number of test items, utilize multiple tools, involve multiple raters and train the students, adopt item analysis. You have robust question banks, pre-validated question bank, item analyzed questions, and certain other things which will build validity is you have to have conduct the exams in a quality manner using standard settings, maintaining the confidentiality. Again, training of students and teachers is very, very important. So by adopting certain simple rules like this, we can definitely build quality into our assessments. In my session, I have covered the session by answering what is validity, why building validity is important, and how do we build validity in our day-to-day assessments. I hope I have met my objectives of the session, that we are all much aware about what is the concept of validity, reliability, and objectivity. How can we build? What are some threats? And how do we go on to the next step of betterment of our assessment system? Ultimately, building quality is a teamwork and a hard work, but it has to begin, take a first step. I'm sure definitely we will all be, from tomorrow onwards, we'll start thinking about, even if we are having a small test, how can I build validity in those tests? These are some of my references. Thank you so much. I'm thankful to my mentors. I had the opportunity to get trained under the giant assessment persons, Mark Gelula, Dr. Stephen Downing. He is the author of this book, Assessment in Health Professions Education. He was my mentor and I have learned a lot from him, indebted to their inputs and grooming me. Dr. Ara Tekian. Thanks to my other mentors, Dr. Kotur sir, Dr. D.K. Srinivas sir, and many of my other teachers. I'm grateful to all of you. Learned many more things wishing to learn many more things from all of you. Thank you so much.
Thank you, Dr. Jyoti. Very informative presentation on assessment. Very extensively you have analyzed and you have given a bright start with the educational spiral and outlined the purpose of assessment. And your objectives, I think at the end of the session, it has been fulfilled, like importance of incorporating the validity into the assessments. And you have looked into the 10 basic threats to validity. And are we measuring what we are supposed to measure, which every teacher is supposed to think over and then set up a question paper, even though if it is a small internal assessment, as you have told, or we are making a big question paper for a university exam, whatever may be, let us have a, let us follow what you have given us the brief outline and very well explain the reliability and objectivity, because all these terminologies seems to be similar, like validity, reliability, objectivity, and you have very well explained it with the simple examples you are able to give us. And you have, finally, you have outlined the goals, threats, and rules in preparing the either the long answer or short answer or MCQ. One thing I felt like we are taking, like Madam was telling, like we take from good things from whomever we are listening to and wherever we go. Like you gave the idea of to have a validated question bank. Maybe every department we have the question bank, but we have to validate it by as a team, and then we should have it. That's what. And you had, I think you had a session on that. You are on preparing a question bank. That's what you have showed on your slides also, and which was prepared at KLE, which you have showed. And finally, you have summarized the 10 basic rules of assessment. Thank you, Dr. Jyoti. Thank you very much. And
Thank you so much.
we can take one or two queries. One query we have from Dr. Mahalakshmi, in the current scenario of UG and PG medical exams, do you think validity and reliability is being overlooked by the concept of feasibility? Whether it is overlooked by the concept of feasibility.
You are talking about, ma'am, you are
UG
talking
and
about
PG medical exams, which is being conducted.
Entrance exams. The concept of feasibility. Yeah,
Feasibility.
I think yes. Sometimes in that formula which I gave in my first slide, one of them may be very good on some score, some values, for example, feasibility. And also not only that, the objective questions at that level will be definitely having their item analysis indices, and also they have a huge beauty of content coverage. They can cover large body of knowledge. We can have questions from every single component, and we also can have questions of different levels. Definitely, usually there should be a match of 80%, 20%, and 10%. 70, 20, and 10. Usually for our basic assessments. In high stakes exam, we can increase the level of difficulty, because especially the NEET exam, I think the difficulty level questions of level 6 can be more. It all depends upon, because as I said, Dr. Stephen Downing was my mentor, and he was a test item writer for USMLE, and he would sit with one question for 2 days. I couldn't even knock at his doors on those days, because lot of science and lot of psychometric analysis, and how the students will understand the question, because a student there can sue. And at the end of any exam, a graph appears, and any flawed item is pointed, and the item writer or the team can be sued. The science is as high and as severe as that.
Madam, it is okay for high stake exams like entrance exams. I think some amount of all these metrics are being used, and it is effort is made to standardize them. But I feel that in the clinical exams, especially when it comes to UG and PG level, we are all the time looking at feasibility or practicality rather than actually into the core test measures of validity and reliability. I may be biased in my opinion, but that is what is my observation.
Yes, ma'am. One single component cannot be overemphasized. Each one should be emphasized, because they have their own advantages into it. We cannot just if we go only with the feasibility, then the other factors will be suffering.
Thank you, madam. We have one more question. Will over-reliance on objectivity compromise the validity in assessment? Will over-reliance on objectivity, relying more on objectivity, whether it will compromise the validity of the assessment?
Exactly. Yeah, that is the difference between long question and the objective question. why we do not have for all clinical examination, practical skills are important. Anything cannot be assessed only with the objective questions. And if we go on doing that using more objectivity, the reliability or validity comes down. I gave you the example of measuring the pressure in the balloon using a tape. Because it is highly objective, I cannot do much with it in terms of validity.
Thank you, ma'am. We have this much questions. I think very elaborately explained the assessment. So everything have been covered by you.
Thank you.
So we don't have any more questions. I hope so. We have Dean sir here.
Yeah, Dr. Jyoti.
Yes, sir.
All I
Yes,
can
sir.
say,
A
this
few
one
words
surprise
from
of
you,
your involvement in this presentation. Everything you have put in such a short period of time, which is very much needed as well for this all rolled out competency-based curriculum, and trying to explain everything in a simplified way. Why 2 long cases? Why 8 long cases? That kind of a data. Says it will, and some simple things, many times will be overlooked. And second thing is, you got trained in those stalwarts, Hara and Gelula, etc. Then finally you have come to the helm of affairs of assessment in our prestigious KL University. I am sure you are doing the justice with your all knowledge which you have acquired. So thank you very much.
Thank you for your kind words, sir. Thank you.
Thank you.
Thank you, Jyoti. It was very nice, elaborate lecture.
Thank you, ma'am. Thank you.
Thank you, sir. Thank you, ma'am. Thank you, Dr. Jyoti, for giving your time. It was really informative session for all of us. Very well explained assessment. As I have said, that everything have been explained very well by you. What you have, whatever you have been practicing, that also you have shared with us. We'll take it into our goal in the future. Thank you, Dr. Jyoti, for giving your time. I thank all the participants who have been with us, enlightening your knowledge on assessment tools and how to validate the assessment tools by Dr. Jyoti. I thank all the participants once again. Meet you next month in the month of September with another very important scientific session. Thank you once again. Dean sir, thank you, sir. Mahalakshmi ma'am, thank you, ma'am. Thank you, Dr. Jyoti.
Thank you for the opportunity, sir and ma'am. Thank you again.
Thank you, Jyoti.
Thank you.
Chalo.